to have Kylie Purdie with me. Welcome, Kylie, to
Hello.
PD in Your Pocket. Can you tell me a bit about yourself as an educator?
So I've been a family daycare educator now for almost about 5 years. I have been in education and care for 30. This is my 30th year in education and care, in a huge variety of roles.
Started very young.
19, not too young, but anyway. But it was, yeah, so I've been in a variety of roles after school care. I've been a director, I've been a trainer, and interestingly, in line with our topic today, I found myself in family daycare because my son, who was 15 at the time, has a chronic medical condition that appeared at about that time, and I just needed to be home. So yeah, that's what led me to family daycare, but I love it. It's been, yeah, so the last 5 years I've been family daycare educator, and it's been one of the best decisions I ever made.
That's great. So what sort of medical conditions have you had to deal with during your time as an educator, either in centre-based care or
so quite a few. It was actually when you posted it on the Facebook page, I was trying to think, and there's a lot of ones that I don't really specifically remember. Obviously asthma is a very common one, so we've dealt with a lot of asthma. I did have a child with congenital heart disease, which was an interesting challenge to have because she had so many medical needs attached to that. We also had a child, and I can't remember the exact medical condition it was, but she couldn't retain couldn't retain calories and things like that. So she constantly had to be fed. So we always, right up until, every hour we had to be making sure that she ate or that she fed, and then she had a tube for a while as well. So that was also a bit of a challenge attached to that. So yeah, I guess that's been the most. We've had children with anaphylaxis, which luckily didn't need much in the way of management, in that we never had it to deal with not an outbreak, that's the wrong word.
Anaphylactic attack.
Yeah, that's it. But we always had to manage it in our service in terms of being aware the whole time. So yeah, so I guess that's the most.
Kylie, have you ever had to deal with a medical emergency?
Medical emergency, yes. So we've had to call an ambulance for an asthma attack. That was quite.
Is this in centre-based or family?
Yeah, so that was in centre-based. I haven't had to as a family daycare educator. I've been pretty lucky so far in that anything that we have had, we had hasn't needed to do that, and that we've been able to manage it. But in centre-based care, we had a child that used their reliever. We followed the asthma management plan, and after a number of times, her breathing did not settle, and in communication with the mum the whole time, because she was at work, which was, was making her way to us, but it was quite a length of time, and she just said, call the ambulance. So we did. So, and then she went.
Was the child okay?
Yeah, the child was fine. They went to hospital. I don't even think they ended up staying overnight. I think they ended up going and having treatment there and then. And I've done that with my own child, so I know what that's like. And yeah, but it definitely can be adrenaline inducing as staff. I have had incidences which aren't from a medical condition that a child has had, but we've also had to call an ambulance for serious injuries as well. So that's just as adrenaline causing as well. But you just do it. You just act. That's where having good management plans.
Sense that one of the advantages of family daycare is often educators and the parents live and work in a small kind of location, so it's.
Yeah, absolutely. I know the children that I've had that have had asthma. So we had one probably 2 years ago. The child had developed, so she had a very nasty case of bronchitis, and it turned into pneumonia or almost, and then from that time on she has needed Ventolin, needed asthma management plan, and needed that in place. But I found definitely the moving from centre-based, both long day care and after school care, and into family daycare, you definitely work much more one-on-one with the families, which I really like. It's easier to, in a centre-based I have nothing against centre-based care, but I find there's always a new educator, or there's always someone new in the room, and you're handing over to someone and you're always, okay, this child you have to be really aware of, this is the management plan, this is this. But with family daycare, you're just constantly in that communication. So you're the person that's there to drop off, you're the person that's there for pick up, you're the person at the other end of the phone. I find that was a lot less stress inducing, I suppose, dealing with that, and supporting families in that way. So yeah.
Okay. Now, one of the things that you and I both commented on in the Facebook group, because we saw it happening, was when I did a call out for people and said, who's dealing with children with medical conditions, a lot of people wrote that they were, when in fact it was disabilities.
Yeah.
So can you talk to us a bit about the difference between disabilities and...
I guess it's tricky for me personally, and we're affected by this in my own family. So my children are adults now, but I have a child who's autistic. So he definitely has lots of challenges and things that we've had to deal with and things that we've had to work with. But he doesn't have a medical condition. So he doesn't need medical support. He doesn't need ongoing medical support. He doesn't need medical intervention. He hasn't ended up in hospital for medical reasons. He's autistic and he needs support, absolutely, but we're not talking about medical support there. I have another child, he's 20, and he has what is called autoimmune hepatitis, which is a significant medical condition, one that needs medication every single day, one that he needs blood tests every 3 months. We need to be keeping an eye and make sure that he's not going jaundice. He has a whole complex medical intervention that is required. So in my layman's terms, not having any medical treatment, that real distinction between needing medical intervention or regular medical intervention, whether it's medication or doctor's visits or that sort of thing, is vastly different to someone that might just need support or inclusion, which means that we need to make our environment help support those children rather than, So for me, I see that. So
I think that's kind of how I distinguish it too. I've also got a child with a disability, and the way that I've learned to do it is the disability is the impact possibly of her medical condition on her life.
Yeah.
So how the medical condition that she had has impacted her life on an ongoing basis. Yeah. Whereas she also has a medical condition, which is epilepsy. Yeah. And so needs treatment for that. And so if she was to go into care, she wouldn't, because she's 30 years old, much older than that. But if she was to go into family daycare, she would need an epilepsy management plan to deal with her epilepsy. But her acquired brain injury, which is her disability, she wouldn't need a plan for that.
Yeah, I've had children. So I worked in an after school care program where we had a significant number of children that came from one of the local inclusion schools, or special needs schools as it was called. And one of those children specifically, he was autistic, but he also had anaphylaxis to a variety of foods. Some unusual ones as well, things like apples and things like that. It was a bit odd. But we had two distinct plans. So we had his autism support plan, which was very different, and that was what we did that, but that wasn't a medical plan. The medical plan we had in place was for his anaphylaxis. So that they're two separate things, and just because someone has one doesn't mean they have the other. So I guess sometimes, and it's you can then start talking about the medical model of disability as opposed to the social model of disability, which is going to be way too big a topic to cover in this little bit. But I think that's where we are. I think we still are very focused on the medical model of disability as opposed to the social model. So I tend to lean towards the social model. So I like to distinguish between what is the medical.
I think that for some educators, and like I'm certainly not judging anyone that wrote down disability in that thing, but I think it's like what they think of as, these are the children that we've got to do some extra stuff with in the planning, in the whatever. but I think it really is important to think in your head about that distinction of, do I need an inclusion support plan for this child, or do I need a medical management
Yes.
plan?
Yeah, I think
and a
they're two
risk
different things.
assessment?
Yeah.
Yeah.
With medical support plans, you engage with doctors, or doctors' plans. Especially an asthma plan is really easy to look at. That you get a asthma management plan from the doctor, and it gives you what medication you're going to take, how often you're going to take that, what might lead to that, and if it doesn't happen, what we need to do in terms of, do we call an ambulance, do we call the parents, do we call all of those things. So there's a very specific medical situation there. When we've had a child that needed other medication given, we get training and support as to how do we need to give this medication to this child. It is very individualized, and I mean, it's individualized for all children, but I don't know, I guess it just has a different, to me, you should be coming from it from a different side, I think.
For sure. Okay, can I just talk to you for a minute about anaphylaxis and the difference between anaphylaxis and food intolerances or food allergies? Because I think it's also one of those things that, parents are prepared to say, yes, my child is, allergic to X or Y. And then you ask, if they've got an EpiPen, etc., and it's not really anaphylaxis. It's not even necessarily sometimes even medically diagnosed.
No, and I've been a very big, that's actually something that comes across very often, that parents will say, oh, they're allergic to, and I'm like, well, can I have some more information about that? And I've learned over the years to be really persistent with that. I'm like, no, actually, I need some more information. I need some more clarification. We had a situation in one of the after-school cares I was at where the parent had said that they were allergic to fish. And I didn't get that. One of the other staff members did the intake, got all the information and all of that. And it was for a school holiday program that I wasn't specifically going to be involved in. So I wasn't really engaged in it. And then I ended up working in the school holidays program, and they said, oh, yeah, this child's allergic to fish. And I used to always have tuna in my lunchbox. That's what I always took. And they said, oh, no, you can't eat that here. And I was like, are you sure? So let me, and anyway, I clarified with the parent later, and they said, oh, no, tuna's fine. Any canned fish is fine. It's just, white fish. You can't have, fresh white fish. I was like, okay, cool. We're not going to have that. So that was a really important thing to clarify with family members. Do you need that? Lactose intolerance is another one. Quite often people can have cooked lactose. They can have cooked cheese and melted cheese and things like that. So it's not actually an anaphylaxis thing. It's an intolerance or a preference even sometimes. And I think we need to be really, really clear. If ever a parent says, my child has an allergy, is that, okay, do they have an allergy plan? Do you have an anaphylaxis plan from your doctor? Do you have anaphylaxis pen, an EpiPen? Do you have a treatment, what you're going to do? Do you have specific foods that you want to avoid? Sometimes it's even down to brands and things like that. They might be allergic to one specific type of, like corn flour. Some corn flour is made out of corn, some corn flour is made out of wheat. So you can't just say, oh, they can't have corn flour, because it is really dependent. So really, really getting detail. Don't just take it by rote. Just say, okay, I need lots more detail about this, because it could be as simple as. And I've had parents that come back to me months later, because I go up to them and said, oh, I'm really sorry, they've had some dairy. And I said, oh, yeah, we've been giving them dairy for months. Sorry, we didn't let you know. And you're like, oh, thanks. So yeah, that's the other thing, is to really be always checking back.
I think it's also important with anaphylaxis to remember that not every child that might be subject to anaphylaxis has an EpiPen.
No, yeah, they don't.
I've got a close friend that has anaphylaxis, but he can be managed just with,
antihistamines. Yeah,
as long as you apply quickly.
Yeah. I've had another friend like that. She was allergic to anaphylactic to nuts, not peanuts, other nuts, and she just needed an antihistamine. That was generally it. So yeah, it's not all just necessarily that you're going to need
and I think that's
EpiPen.
the sort of thing that you need to work out in your risk management plan. Can I just ask, with risk management plans, how do you go about drawing them up?
Well, our service particularly has preferred formats, basically, for starters. So making sure we have that. But I try and gather as much data as possible. So I'm always saying to the families, okay, you need, give me as much detail as you can for something like that. So when it's something to do with medical reasons, it's like, okay, give me every worst case scenario you have or in your mind so I can have an idea of what it is. I also look at my own home. So for example, in my home, I actually say to families, this is not a nut-free house. It's not nut. My autistic son, nuts are his main form of protein, so it cannot be it cannot be a nut-free home. So we have those conversations. So we gather as much information as possible and have a look at that. So is nuts going to be a problem in my house? There is a risk. We have Nutella, we have peanut butter, we have that sort of thing. Do I serve it to the children? No. So family, that would be something in my risk management plan that I would put down if that was something that I would come in. So it'd be gathering as much information, sharing my information.
So how would you manage that particular risk?
With that situation, honestly, I suspect a family would not then use my services. Honestly, I think that they would. But in saying that, my own son, the same son, when he was in preschool, he actually went to a preschool where they had a child who was anaphylactic to nuts, but the preschool was amazing and actually supported us, knowing that nuts were his main form of protein. At the time, he was diagnosed with ADHD, not autism. And we knew that good doses of protein for us, we knew that that supported him and to be able to help to stay attentive throughout the day. Like any children, really, you give them good sources of protein, that's what happens. And they had a whole big process, and they talked to both us and the other parent, and they served him on one table on one side of the room, and they make sure that the other child sat on the other side. They had a special bucket that had all the cleanup for my son's things. So they put those things all in place. And there was a discussion.
Sounds like an amazing service.
Oh, honestly, it was one of my most favourite preschools actually when I was in Adelaide, when I lived in Adelaide. And they put families first, and all families. And that's not to say they put others at risk. It was definitely a conversation. And I would never have said, if that family was unhappy, I would never have pushed it. But they sort of said, oh no, leave it with us. We're going to see if we can come up with a plan. And they did, and it worked. And as far as I know, there was never any issues. So there's always ways to manage risk, I think. And if it becomes too much, well, then either that's not a match, and that's okay. So if the service isn't a match for the family, then that's okay. I think that's the other thing we need to remember, is that it's okay that sometimes it doesn't match.
For sure.
Yeah.
So what's the best advice you'd give to an educator that, is on the verge of enrolling someone with a medical condition?
Families are your absolute best resource. And I think sometimes we like to, I was actually making a few notes after we spoke yesterday, and I was just thinking about it. And I know that the families and parents are not medical practitioners, and sometimes they have, this works. I know it's not what they require, but they're still your best resource. They know their children, they know what works, they know what doesn't. We then making sure that we ask lots of questions. If you're a little bit uncomfortable, you ask. Having a child who's medically complex, which like I do, ask questions, and no one's going to be offended. A parent is not going to be offended if you are asking lots of questions. So if you're concerned, you go down. The other one is to be careful of black and white rules. So we haven't mentioned it, but it's actually when I put the medical condition up. So my eldest son has a medical condition called juvenile recurrent parotitis. So it is a recurrent swelling of the parotid gland. So he's had mumps about 40 times. So it's bacterial, it's not viral, but it causes a huge amount of pain and it causes a fever. Management is paracetamol or ibuprofen, either one. And he takes it, and he took it at the service, he took it at school, he took it at everything. And a lot of services go, no, we can't administer Panadol. If they need Panadol, they need to go home. If they need paracetamol, they're sick and they should be at home. And I'm like, well, actually, you can't be that black and white, because for some families, managing that pain, if you can't manage that pain at the service, that child's never going to attend anyway. So I think having black and white rules in your head about what you can administer, what you can't, is not the right way to approach it. You need to be aware that there are nuance in all of those things. So I think those might be things. The parents are your really biggest resource. Ask lots of questions. Get medical plans in place. Don't be afraid to ask to medical plans. And just be aware that things are not black and white, and that you need to be able to see the nuance and the differences that might occur for other families. So yeah.
Sounds like brilliant advice to me. Thank you very, very much.
My pleasure.
Okay, thank you.